Hello there. Welcome to Activating the Creative in You, where we gather and highlight everyday people who are making a difference. And today we are going to make a difference because we have a wonderful guest here. Um, we have my wonderful husband, George Berrios, who is going to be sharing with us some information regarding COVID. Are we really over COVID? That's the big question that we are facing today. And my biggest concern with this is because today, earlier in the morning, we decided to do some grocery shopping and we went to the local grocery store. And when we were there, I noticed that some people were not wearing a mask. And according to the sign at the entrance, the requirement was if you come into the store to shop, you wear a mask. So I did see some people not wearing a mask. And my thing was, where are the people who are supposed to regulate this problem? Why are some of us wearing, and how long will it be wherein everybody will just stop wearing the mask? And as you noticed lately, the whole COVID pandemic has been kind of pushed out of the media. We're not hearing much on what's going on, and we have other things that are pressing us, concerns that are very valid regarding injustices that have been done towards individuals. And yes, we have to deal with that. It's something that you cannot ignore. But at the same time, I'm left with the question, what happened to the whole anxiety and the chaos and the whole, commotion that was right before this situation regarding the COVID? And where is COVID? Are we over it today? So we have some questions regarding that. And I invited George because George is a person that can speak with authority regarding this subject. He's going to give us a little background on the kind of work he does every day. So George, will you give us a little bit of a background regarding the work that you are doing behind the scenes regarding the COVID situation?
Okay, well, Nance, I am a pharmacist by trade, and I'm actually a healthcare consultant, and I work as clinical director for a large healthcare corporation, and we work with the hospitals in terms of helping them to organize their protocols and plans for situations like COVID. That's one of the areas that we work with, and we've been pretty active in terms of making sure that the hospitals receive supplies and medication during the COVID pandemic. And so we've been quite involved with hospitals and with their preparedness for this COVID pandemic.
Now, are you seeing an uptick in COVID? Still, is it still on the uprise, or has it leveled off? Have you seen a difference taking place in the last few days? One of the biggest concerns that I have seen is now that with the protests, we're also having groups of people who are no longer following the protocol of social distancing. I mean, uh, the 6 feet thing doesn't, it's not being applied. We see people that are now wearing the mask. So has there anything on your end? Has anything changed? Is there information regarding whether we're having more cases of COVID or not?
Well, the cases of COVID have leveled off. However, they are continuing to increase in total numbers. Just the last I checked, I think the data was from through yesterday, through Friday. The Centers for Disease Control, the CDC, posted that there were 109,192 deaths due to COVID. Um, the good news was that the overall rate of cases in the United States is just under 1% of the total for the death rates are less than 1%. However, of course, we know that in the higher risk populations, it's a lot higher. So that's where we have to exercise caution, and especially when we're getting together in large groups, which is what we're seeing with the whole situation with the rioting and the looting and the demonstrations.
Now, you said there has been still groups of COVID, the numbers going up. In which particular populations are you making a reference to?
Well, overall cases are up. It's close to 2 million cases in the United States confirmed. So that's probably the most in all of the world that have been confirmed. Granted, we do a better job of testing than a lot of the countries, but we're seeing that it's close to 2 million at this stage, and we're not even near um, plateauing, or basically not plateauing, but we're not near the bottom yet, or so we're not out of the woods.
So it's still climbing.
It is still climbing. Just to give you an example, I was looking at the number of cases over the last 3 days of data that they have. So they have data for Wednesday, Thursday, and Friday. And we see in the CDC website that there were 14,676 cases on Wednesday. By Thursday, there were an additional 20,555 cases. So it went from 14 to almost 21,000 from Wednesday to Thursday. And then it jumped on Friday to 29,000 newly reported cases.
Now, what age group is being most falling into this category of being affected by COVID?
Okay, so death rates, of course, we know that they're going to be much higher in the 66-year-olds, 65-year-olds and higher. They're going to have higher death rates. However, when we look at the number of people who are getting tested positive, we're seeing that the cases for 18 through 44 years of age are the majority, followed by 45 to age 64. So between 18 years and 64 years of age, almost 2/3 of the cases are occurring in those age populations.
Okay. Now, but the deaths are occurring more with the older population, right?
Yes.
Now, is it a particular racial group only, or is it now across the board with all groups?
Well, when you look at the number of cases themselves, if you look at it by racial demographic, 45%, so almost half of all cases are whites.
Okay.
So the white population is almost 50% of the cases, so almost half. And then you're followed by the black non-Hispanic population are 26%, so about 1 in 4, and of all people in the United States. And then the Latinos are followed by that by 20%. So we're at 20%, the Hispanic population.
So we're seeing an uptick in number of COVID cases rising since in the last week, and we're also seeing more deaths as a result. So we're not really plateaued.
No, just last week it was about 100,000 cases, and this week we're at 109,000 cases. So we had another 9,000 people die in the past week or so.
That's horrible. And that has not been really talked about much in the media. So what are your suggestions? I mean, I know that we have a lot of other pressing concerns that are taking our attention because, yes, there are issues that need to be dealt with, but what are your tips and suggestions? Because I'm thinking, no, we're not over. Yet there seems to be like a relaxation now that the city has opened up. We're on stage 3, open restaurants. So that doesn't mean that we're going back to the way things were, right? So what are your suggestions?
Yes, I think there's a danger in the idea that, well, the government decided that we're in phase 3, we can get together in small groups, so everything's okay, right? And my answer to that is no, it's not okay. There's still, the number of cases is still rising, especially when these groups, such as what we've seen in the past week, continue to gather. It's very possible that over the next week or two, I would estimate that in the next 2 weeks, we may see a rebound effect or a second wave, being that this is not over. And we're seeing a lot of people taking risks and not being worried about their hygiene, not wearing the masks. And so we may be seeing a rebound effect due to all of these conditions.
And unfortunately, those who are going to be affected the most severely are those who are in the age group that where most of the cases have resulted in death, right?
Correct. So let's say you have young people who they're the majority of the cases, and they'll get COVID, they'll be positive, they'll recover. They'll be fine. However, they may silently be carrying this back to their parents, their grandparents, and their neighbors. And that's the part that becomes dangerous because they may be harming the people around them without thinking that anything's really happening. And unfortunately, I have seen cases where a younger member of the family has brought it back to the home, and the grandparent who lived in the house was affected and actually passed away because of this. So there's that risks that people don't realize is occurring. Now, getting back to your earlier question about what can we do, I think we have to maintain our hand hygiene, washing our hands as much as possible whenever we are contacting surfaces outside of the home. Even when we're in the home, we should be cleaning the surfaces on a regular basis. We should be wearing the masks and taking the distance precautions when we're out in the open. So I think that does not change. However, it seems that the less it's talked about, people are getting more comfortable and relaxing to the point of not following the precautions.
So when we started, we were talking about the question, are we really over COVID? And what the answer to that is?
Well, the answer is no. We're not over it. As a matter of fact, we may be seeing it resurface stronger based on all of the close contact activities that have been going on over the past days and up to now. I think it's been going on for over a week now. The demonstrations, the rioting, the looting in some of the cities. And so, unfortunately, we have not seen the end of it.
Okay. So precautions should be continued. We're not over COVID. Continue to wear your mask, continue to practice hygiene, continue to keep social distance in consideration, which means you shouldn't really be gathering with large groups of people, and try to be considerate, because you may be one of the folks that fall in the category of carrying the COVID in your system, but it doesn't affect you, but you can bring it to someone who's more medically fragile, and that's the person that's going to really pay the price for our lack of responsibility or consideration, because that's the mystery that we have regarding this disease. One more question. Are they still working on some kind of, like, what is it, vaccine?
Yes, they are. I would say that the vaccine is being developed. It's promising, but we have to understand that a vaccine typically takes about a year to a year and a half before the vaccine is ready to be released to the general public, and where they make sure that it's safe, where they've done enough tests to ensure that it's effective. So this may be, we're talking possibly next spring at the earliest, maybe even the fall season, before the vaccines are ready to be distributed to the general public.
Okay, well, great information. Well, I think we've shared with you some information. We're hoping that if you stuck around to the end of the show, you've been able to gather some insight on how to deal with COVID. We are not over COVID. It may look like it or seem like it because we are not constantly being bombarded with COVID news on an everyday basis all day long. Other things have now taken that spot. But people, pay attention and take care of yourselves. And thank you so much, George, for joining us.
My pleasure.
You have been able to give us some wonderful information and insight. And like I mentioned before, this is activating the creative in you, and we like to highlight everyday people who are making a difference. And one thing I want to mention about creativity is that creativity is a phenomena that takes place when you are able to create something new that adds value or at best uniquely solves a problem. And today, George, you have helped us solve a problem. You have given us some information regarding the question, are we over COVID?
Thank you, Nancy.
Thank you, and see you again soon for activating the creative in you.